Introduction. Metformin is a widely used medication for managing type 2 diabetes. It helps control blood sugar levels and is often prescribed as the first-line treatment. It is an oral medication available in tablet and liquid form, also known by brand names like glucophage. Mechanism of action. Primary action. Improves insulin sensitivity and lowers blood glucose levels. Main effects. Reduces hepatic glucose production. Liver makes less glucose. Increases insulin sensitivity in muscle and fat tissues, helping them absorb more glucose. Decreases intestinal glucose absorption, leading to less glucose entering the bloodstream. Does not stimulate insulin release, which lowers the risk of hypoglycemia, low blood sugar. The exact mechanism of action is not fully understood, but likely involves AMPK activation, improving insulin action. Side effects. Common side effects. Gastrointestinal issues, nausea, vomiting, diarrhea, bloating, and abdominal discomfort. Metallic taste in the mouth, loss of appetite. Serious side effects, rare but serious. Lactic acidosis, a severe condition caused by the buildup of lactic acid in the blood, very rare but serious. Vitamin B12 deficiency. Long-term use may interfere with vitamin B12 absorption. Minor side effects, fatigue and headache. Skin reactions, rash, itching in rare cases. Management. Take with food to reduce gastrointestinal side effects. Contraindications. Kidney problems. Contraindicated in patients with severe kidney disease. eGFR 30 ml MN1, 73 square meters. Caution in patients with mild to moderate kidney disease. Liver disease should not be used in patients with active liver disease. Acute or chronic metabolic acidosis, including diabetic ketoacidosis. Hypoxia conditions, such as severe infection or heart failure, where oxygen levels may drop. Pregnancy, typically avoided unless necessary. Risks are not fully known. Breastfeeding. Caution is recommended during breastfeeding due to potential unknown risks to the infant. Maximum daily dose. Maximum recommended daily dose. 2,000 milligrams to 2,550 milligrams, depending on the formulation. Typically divided into 2 or 3 doses per day. Dosing should be started at a lower dose, for example 500 milligrams, to minimize side effects, then gradually increase. Most popular international brands containing this generic and manufacturer name and country: Glucophage, brand name, manufacturer, Merck, USA, Glucophage XR, extended release version, manufacturer, Merck, USA, Fortimet, extended release version, manufacturer, Amgen, USA, Riomet, liquid form, manufacturer, Amgen, USA, Metformin hydrochloride, generic name, manufactured by various companies worldwide, for example, Teva, Milan, Aurobindo Pharma, Dr. Reddy's Laboratories. Available in multiple countries like the USA, UK, India, Canada, and Australia. Adverse events, including use with a meal on an empty stomach or with any specific food. Common side effects. Gastrointestinal issues, nausea, vomiting, diarrhea, bloating, and abdominal discomfort, especially when starting the medication. Loss of appetite and a metallic taste in the mouth. Food-related advice. It is recommended to take metformin with food to reduce gastrointestinal upset, such as nausea or diarrhea. Taking it on an empty stomach may increase the likelihood of gastrointestinal side effects. Serious adverse events, less common. Lactic acidosis, buildup of lactic acid in the blood, can be fatal. This occurs very rarely, but requires urgent medical attention. Vitamin B12 deficiency after prolonged use could lead to anemia and nerve damage. Managing adverse events. Gradually increasing the dose helps minimize gastrointestinal side effects. Taking metformin with meals may reduce the risk of nausea and other stomach-related issues. Drug interactions. Increased risk of lactic acidosis. Alcohol. Excessive alcohol intake increases the risk of lactic acidosis. Cimetidine may increase metformin levels in the blood, raising the risk of side effects. Kidney function. Renal function. Drugs that impact kidney function, like ACE inhibitors, NSAIDs, or diuretics, can increase the risk of metformin accumulation and related side effects. Blood sugar. Lowering drugs. Insulin and other oral anti-diabetic drugs. Combined use may increase the risk of hypoglycemia, low blood sugar, especially in elderly patients. Iodinated contrast agents. When used with contrast agents for X-rays or CT scans, metformin may need to be temporarily stopped due to the risk of kidney damage and lactic acidosis. Other interactions: steroids, diuretics, beta blockers, and thyroid medications may affect blood sugar levels and require closer monitoring when combined with metformin. Food interactions: metformin can be taken with or without food. Taking it with food helps to reduce gastrointestinal side effects, for example, nausea, vomiting, diarrhea. Avoid taking on an empty stomach as it may increase the likelihood of stomach upset. Alcohol consumption should be limited or avoided as it can increase the risk of lactic acidosis. No significant specific food interactions. However, eating balanced meals is recommended to maintain steady blood sugar levels. Pharmacology, class, biguanide, oral anti-diabetic agent. Primary mechanism: improves insulin sensitivity and reduces blood sugar levels by affecting insulin resistance. Works primarily by decreasing hepatic glucose production by the liver. Enhances peripheral glucose uptake and utilization, especially in muscles and fat tissues. Does not cause insulin release, so it does not lead to hypoglycemia, low blood sugar, unless used with other hypoglycemic agents. Pharmacodynamics: action on the body. Reduces blood glucose levels by acting on the liver and muscle tissues. Decreases hepatic glucose production, mainly by inhibiting gluconeogenesis in the liver. Increases glucose uptake in muscle and fat cells, enhancing the body's ability to use glucose. Improves insulin sensitivity, allowing muscles and fat tissues to utilize glucose more efficiently. No effect on insulin secretion, so there is no risk of hypoglycemia when taken alone. Clinical use: primary treatment for type 2 diabetes, especially for overweight patients or those with insulin resistance. Can be used alone or in combination with other diabetic medications, including insulin or sulfonylureas. Pharmacokinetics: absorption. Well absorbed orally. After ingestion, about 50 to 60% is absorbed from the gastrointestinal tract. Extended release formulations have slower absorption to help reduce side effects. Half-life: 4-9 hours for the immediate release formulation, up to 17 hours for the extended release formulation. Metabolism: primarily excreted unchanged through the kidneys. No significant hepatic metabolism, does not undergo major processing by liver enzymes like many other drugs. Excretion: excreted unchanged by the kidneys. Renal function plays a crucial role in metformin clearance from the body. Impaired kidney function can lead to accumulation of the drug, increasing the risk of side effects, especially lactic acidosis. Duration of action: immediate release, 6-8 hours. Extended release, 24 hours, allowing once daily dosing. Chemistry: chemical formula C4H11N5 represents the molecular composition of metformin. Molar mass: 129.16 g per mole, the weight of 1 mole of metformin in grams. Half-life: 4-9 hours for immediate release formulation, up to 17 hours for extended release formulation. Melting point: 100 degrees Celsius. Metformin starts to decompose before reaching its melting point. Solubility: very slightly soluble in water, about 14 mg/ml at 25 degrees Celsius. Slightly soluble in ethanol. Organic molecule class: biguanide. It belongs to a class of compounds known for their anti-diabetic properties, specifically targeting insulin resistance. Bioavailability: 50 to 60% after oral administration. The drug's bioavailability is reduced when taken with food, which can help in managing gastrointestinal side effects. References: the following references provide important studies and findings on metformin. Book name: Goodman and Gilman's, The Pharmacological Basis of Therapeutics Country, USA date, 13th edition, 2017. Study findings: comprehensive pharmacological details of metformin and its action, metabolism, and clinical use in type 2 diabetes. Website name: drugs.com. Country: USA. Date: updated 2023. Study findings provides extensive details about metformin, including its uses, side effects, dosage, and interactions. Website name: PubMed. Central Country, USA. Date: 2020. Study findings: clinical studies supporting metformin's role in treating type 2 diabetes and managing blood glucose levels, with a focus on long-term outcomes. Study: metformin and its role in the management of type 2 diabetes mellitus. Country, USA date, 2019. Findings: clinical evidence highlighting metformin's effectiveness in lowering blood sugar levels, reducing insulin resistance, and improving metabolic control. Website name: National Institutes of Health, NIH, Medline Plus Country, USA, date: updated 2023. Study findings: detailed information on metformin, including its approved uses for type 2 diabetes, its mechanism of action, common side effects, and clinical guidelines for its use.